afternoon, everybody. I'm Dr. Sujata Sharma, the president of Biofootprints, which is a society meant for science promotion. And continuing with our lecture series, we have a very eminent speaker with us, Dr. Saurabh Bhatia. I welcome you, Dr. Saurabh. Dr. Saurabh is a consultant and head in the dermatology department in the Felix Hospitals, Noida. And let me introduce him further. He has done his MBBS and MD from AIIMS New Delhi. And further, he has done 3-year senior residency again at AIIMS New Delhi. He's on the reviewer board for 4 international and 2 national journals in skin disorders and management, with various publications in national and international journals. During residency, while doing his thesis on vitiligo, he developed a keen interest in patients' attitudes towards the skin and its disorders. With specific chronic diseases like vitiligo, he holds a particular proclivity regarding patient counseling and making them understand their disorder so that the disease can be holistically managed and the patient and doctors can treat this disease together. So today he is going to be talking about vitiligo and specifically the topic that he has very imaginatively entitled Vitiligo is Only Skin Deep. So over to you, Dr. Saurabh.
Good afternoon, everyone. Good afternoon, ma'am. Thank you for giving me this opportunity to talk about a disease which hampers quite a lot more than just the skin. So we think that vitiligo is skin disease, but clearly it's not, because the perception of patients, their family members, and the society in general leads to this disease being taking a more aggressive form on the mind as compared to just the skin. So I'll just start with sharing my presentation. So with that, I'll just switch over to my PPT and we'll talk a bit about vitiligo. So what vitiligo essentially is, it is the destruction of skin cells. So let me introduce you to one female. Her name is Winnie Harlow, and she is one of the leading top models in the world. And she, as you can see, suffers from vitiligo. So she must have tried multiple treatments in her life, in her childhood. She has been suffering from this disease since she was a kid. But still now she's on top of her ladder in spite of having vitiligo. And the reason behind that is she has always ignored it. That's what she usually says, that she doesn't care what her skin looks like. And it's very debilitating when your skin color, your natural skin color is of the darker shade. Now, let me bring back everyone to a bit closer to home. So I will not tell the name of this minister. I want you to Google and search and read about him. He's a very top tier minister in the BJP government and suffers from vitiligo. And as far as I can see the photographs, it's a progressive vitiligo. That means the skin depigmentation or the loss of color is increasing over the years. But still, that has not stopped him from reaching the echelons of the political ladder. And he has a comfortable seat as a member of parliament for closely to around 40 years. So what exactly is vitiligo? So as I've started in the PPT, it's destruction of cells in the skin that carry the color molecules. That color molecules is melanin, and that is what imparts the color to our skin. So all the Caucasian race, the white skin people, then we are the brown skin, then the darker skin in the Africas, all have melanin to a certain extent and difference in the content. And the destruction of these cells is what causes vitiligo or the loss of pigmentation. And it's quite a common disease in the world. It ranges from around 1% to 8% in certain areas, but we usually take around 1% prevalence. That means 1 out of every 100 people would be suffering from one or the other forms of vitiligo. Now, the major issue that vitiligo carries, it is not the destruction of color, it's not the progressive nature of disease, it's the associated very high cosmetic burden it has. It just doesn't look good to be seen with vitiligo. And because the other people perceive this disease as something quite devastating, and there's a certain social stigma attached to it, and that will lead to further problems when a patient suffers from vitiligo. And this kind of attitude towards the patient leads to a very high psychological impact of this disease. So why does vitiligo occur? So as I've said, it's destruction of color cells, and there are multiple theories why these cells ultimately get destroyed. Most common is the autoimmune theory, that somehow our immune cells think of these color forming cells as enemies and they destroyed it. There's also a genetic component. So if you have a family history, there is a slightly higher chances that you might develop vitiligo at some point. But majorly the cases that we usually see, they are usually sporadic. That means they occur on its own and there's no significant family history could be found out on asking the patient. Now the question, the number one question the patient asks us is it treatable? The answer is a straightforward yes, it is treatable. For that, you need to consult a qualified dermatologist who knows what he's doing. There's no need to go to other quacks or alternative forms of medications. And there are multiple modalities which we can use to treat. Is we start from the medical management that includes medicines to be taken orally or applied on the lesions. We can go forward to phototherapy, in which we use the natural sunlight rays to treat the vitiligo, or we use artificial sources of light like narrowband therapy. If the disease is not progressive, that means the area which is white doesn't have the cells to form color, but it is not increasing in size and there are no new areas forming, then we can transplant the color forming cells from other parts of the body into the white part so that we can start the color formation again of the affected site. And this we do for the various vitiligo surgeries. And the last is camouflage. Camouflage is just hiding it. It's like glorified makeup. You cover the white areas, the color matches with your background skin, and you can go out and have a 1-day party, 2-day party. So it's a very short-term management, but it's one of the most important management in a short term. And the most important part, which kind of encapsulated all the medical management or surgical management, is counseling. You need to counsel the patient first, tell them what disease they have, tell them that usually it is somewhat predictable, but it has marked by a very unpredictable course also. It can show a variability in progression, and it is at any given point of time, it is treatable and manageable. And there are multiple modalities which we can use either alone or together in conjunction to handle this disease. So counseling becomes a very important part because there are other psychological factors also attached to this disease, and multiple times the healthcare provider somehow overlooks that. So we need to do counseling and find out if other factors are also in conjunction with vitiligo. So it is treatable, but first we have to stop the progression of disease. So how I explain to my patient is that when there is a forest fire and there's destruction of trees, you don't start planting new trees. You first quench the fire, you first put out the fire, and then you look at the damage, and then you start planting the trees. So the progression of disease has to be stopped first, so that there is no increase in the depigmentation or the loss of color. When the disease is stopped, then we can start to think about majorly how to bring the color back, and then reattainment of pigmentation can be taken care of. And also, since stopping the progression and reattain pigmentation are the disease specific factors, the third point, which is prevent dehabilitation, takes care of the counseling and the psychological aspects, because multiple times patients either lose their jobs or they quit their jobs because they want to get better, treat their vitiligo first, then join their jobs, or they are postponing their marriages, or significant family functions are being postponed because they want to get treated first and then started. So that leads to a lot of delays in normal situations. So we need to prevent that and ask them that the treatment will go on a sideways in a parallel track, and they can carry on with their life normally as they would have if they did not have vitiligo. So here I would like to show some clinical pictures. These are patients that I have seen, and in the OMP group. So what OMP is, it's just a high dose steroids given for a short duration of time to stop the progression of disease. And we can clearly see that the loss of color, which is seen on the feet, is gradually improving. The color forming cells are gradually migrating, they're forming color. We are focusing more on the cells to form the color and get back the skin color which they have lost. So we can see there's significant color formation over the course of 6 months. And here also with this patient was also given OMP, which are the high dose steroids, along with application of medications. And we can see over the course of 6 months, there was significant attainment of skin pigmentation. Similarly, over the areas which are majorly neck, trunk, back, they respond very good with medical management. Face, it responds very good with medical management, and we can see there's significant reattainment of color. Here, over the course of 6 months, we can see practically disappearance of vitiligo lesions with medical management only. In this patient we also gave the phototherapy, which means we gave artificial UV radiation using narrowband photo lamps, which are perfectly safe, and they have been they lead to a good color pigmentation over it. So we can see that the neck area, which was completely depigmented, over the course of 6 months, we managed to recover all of the pigment which they had lost. Similarly, this patient was also given narrowband phototherapy only, and we can see that over the course of 6 months, this first photo and the last photo is 6 months apart, and we can see that the larger areas which had lost the pigmentation, we have been able to get nearly all of it back. Now here we come about the surgical methods in vitiligo. So when the disease has stopped progressing, or if the lesion is very small and we need to take care of it, we have multiple surgical modalities to implant the color cells from other areas into the white patches so that they can act as a source to bring back the color. So what I am depicting in these few images is known as mini punch grafting, in which we take small skin pieces or tissue pieces from other areas. Now, these areas are hidden. They're usually the back of your thigh or the side of your thigh or back of the ear. We take small pieces of normal skin color. We make small holes in the white areas, and then we implant those color forming cells inside those areas, and then we seal it off. Now, these implanted areas have normal color forming cells, and then they will act as a nidus, as a focus to form more color around it. So in the last photo, you can see that at the nipple area, it's completely white because of vitiligo. We implanted the color cells, the tissues from the other side, which are normal tissues. And after dressing, they have been significantly stuck to the areas now. And we can see that after therapies, they have acted as a nidus to form new color forming cells in the vitiligo area. And that has led to the reattainment of pigmentation. Now, this is one of the most advanced vitiligo surgeries. In this surgery, we usually take a very thin sliver, a very thin layer of the epidermis from a hidden area or the donor area. And then this skin is treated with various chemicals to take out the color forming cells alone. Then we make a suspension of those cells in a liquid. This is the recipient area or the area in which the vitiligo patch was there. We remove the overlying skin from the area, and then we implant all the solutions which we had created, which are full of color forming cells. We implant it and we dress it with collagen dressing and stick dressing so that it doesn't get disturbed. So the advantage of this type of surgery is that you can cover a larger area with only a small tissue sample. Also, it gives a more uniform color. Now let me divert you to some of the misconceptions that people have with vitiligo, which is one of the major areas of this talk. That patients with vitiligo, first of all, they are suffering from vitiligo, a disease which they won't understand, and as a healthcare provider, you have to make them understand. And second of all, the other people would foreshadow their misconceptions about vitiligo, what they think about vitiligo, and because of that, there's a huge change in behavior towards the patient, and that leads to further problems for the patient. So there are many misconceptions regarding vitiligo. For example, it's because of the past karma, something you have done in your last birth, and that's why you're suffering from vitiligo in this birth. Or it is contagious, it spreads by contact. Or is it because of some kind of diet and you need to practice diet restrictions? You need to stop taking foods which are white, like milk products. You have to stop brinjals or fish with milk. So these are all sorts of misconceptions. Vitiligo is confused with other disorders like leprosy and skin cancer. So in our ancient Ayurvedic texts, there have been instances where it has been confused with leprosy because this looks similar. But I would take this opportunity to say that vitiligo is curable and leprosy also is curable with good treatment. And all these disorders, and whether you can differentiate between these disorders, for that you need to consult a good dermatologist who knows how to manage all this kind of skin disorders. Now, vitiligo is associated with mental or physical impairment. That is completely lie. There is no change in any kind of ability of the patient. It is, as the title of this talk, it is only skin deep. It will only damage the color forming cells. Nothing is going to go on inside. And the patient is as good as any other person around them. The misconception is that it has a predictable course or a presentation. Now with vitiligo, there have been multiple studies in India and abroad to find out various factors with which we can analyze the patient and say whether the disease is going to go in such and such amount of time, or whether it is rapidly progressive and whether it would come back again after stopping. So as of now, there are no clear-cut definitions or indicators that would tell whether the disease is going to come back after being quite down. But this kind of misconceptions that the disease is going to go on throughout the life, that damages the psyche of the patient who's suffering from it. Apart from that, the alternative forms of medication like Ayurveda, oil, supplements, people tend to deviate from one specialty to another specialty, and it's not at all their fault. They want to get better. They're suffering from a disease which is debilitating for them psychologically, financially, and also in society. And they want to try each and everything under the sun so that they can get better. And that leads them to switch these specialties. And in the long run, it won't help them. So the biggest misconception about vitiligo is that it is not curable. That is completely lie. It is perfectly curable. It is perfectly manageable. You just have to go and consult a good doctor who knows how to treat vitiligo. So I would like to share just a photograph of one patient that I treated. So this patient had vitiligo, complete loss of pigmentation over both of the hands. And on consultation with a near friend, he applied Ayurvedic oils without consulting any of the registered medical practitioners. And that has led to a significant destruction of his entire skin. The skin has eroded well. And he presented us with large fluid-filled, water-filled blisters on his hands with severe pain. And frankly, it took around 1 week for him to recover from first picture to the next picture. And the pigmentation, the loss of pigmentation was as is. There was no regain of pigmentation. So that happened because patient wanted to try anything without consulting doctors. And this leads to multiple side effects, which leads to more, mental destruction, or you can say more impact on the thinking of the patient, that he's trying everything under the sun and nothing is helping, and he's only getting the side effects and disadvantages. Now, a major chunk of misconception is that you have to change your diet. So there have been multiple restrictions in diet, which patients, family members, or neighbors, or society, or sometimes other doctors too, they prescribe them or they advise them that they have to avoid sour food, they have to avoid fish with milk, or they have deficiency of calcium in their diet. That is why they're getting vitiligo, or there's deficiency of iron or vitamin C. Now, there is, as of now, no dietary restrictions in vitiligo. Nothing that you will eat will lead you to have vitiligo, or nothing that you will stop will lead you to have an improvement in vitiligo. A patient needs to have a balanced diet. Mostly as a healthcare provider, we come across these kind of restrictions when there is childhood vitiligo or children suffering from vitiligo, that doctor, what can we give them? Do we have to stop something? And I have treated patients who have stopped giving milk to a growing child. So milk is important for a growing child, and we cannot stop that. The normal nutrition supplied by normal balanced diet is absolutely essential. So you don't need to restrict anything. Take diet as others are eating. You don't have to make any changes to your food items. Now, what these kind of misconceptions lead to? They lead to stigma, because the patient doesn't understand, but at least he's talking to a doctor to find out about the disease. The people in society, they have their well-formed or I would say ill-formed thinking about vitiligo. They have all sorts of rumors and wrongful information, and because of that, that leads to stigma around the disease. So if a person has vitiligo, they have to suffer from vitiligo, and then they have to suffer from the ostracization from the society and discrimination from the society as well, with no fault of their own, just because the third person thinks wrongly about a disease, and that is leading to a huge mental impact on the patient. So first of all, vitiligo leads to cosmetic disfigurement. That means if it's on the exposed areas, like on the face or on the back of the hand, so that leads to a disfigurement. And also certain sectors of society like the armed forces, they completely reject if the patient has vitiligo. So that is one area which I have yet to understand why that is taken care, why the armed forces refuse to recruit people who have vitiligo. Now, this kind of attitude of society or the people in general towards the patient suffering from vitiligo leads to depression, self-image issues, and a complete lack of confidence in themselves. So there have been multiple studies in which they have found that depression can be as high as 44 to 45% in patients suffering from vitiligo. Also, in one study showed that the risk of suicide or suicide ideations is as high as 8%. And a lot of those factors are a culmination of the attitude of other people towards the vitiligo sufferer. There are multiple companies or job areas, like I've mentioned, armed forces. There are multiple companies in private sector also, which will not hire if the patient has visible vitiligo. Also, the social interactions and personal relationships are also affected. In multiple studies, it has been shown that it's around 3 to 4 times to 10 to 20 times more difficult for a vitiligo patient to start a new social relationship with anyone, be it their family members, be it their spouses or significant others. So it becomes increasingly difficult for them to start a new relationship and also make the other person understand what they're suffering from and how they are going to treat it. Now, let's say if you have vitiligo or you know somebody who has vitiligo, what to do? The first and foremost, the most important point is that you do not have to worry. You will not do anything by worrying about the disease. It won't change the progression. It will harm you. Ultimately, it won't give you any positive impact. You need not worry. You just have to consult a dermatologist. Be regular with their treatment and follow up advices. See, vitiligo is a chronic disease which is marked by various periods of increased activity and decreased activity. It might lay stable for years altogether and then start progressing. It might be progressive for months and years. You just have to be patient and be following with your dermatologist who knows how the disease is progressing so that they can change and titrate the treatment as per your needs. You continue with your healthy diet. As I've mentioned, there's no dietary restrictions. So you keep on taking a balanced, healthy diet. The most important part, and that is that now I'm targeting towards the family members and society in general, hand holding and care is very important. First of all, if you hold the hand literally, it reassures them that vitiligo is not contagious. It doesn't spread by touch. So, because most of the time, patients are completely boycotted. They are not touched by other people. They have a misconception that it spreads by touch. So that is not there. You need to hold the hand literally and also emotionally. You have to be present with them. They are taking treatment, which in most instances would be a chronic or a long-term treatment. And they need to have a good social support and a good moral support from their peers. Now, the last point is important, which I usually assert very strongly, is to spread correct knowledge about the disease. I always say to my patient that since you're suffering from the disease, you should act as a beacon and spread the correct information about the disease to your surroundings. So if you see someone who is telling you something which you know that it's wrong, tell them that they are wrong and this is the correct thing, and they should find out more information about the disease and then talk about it. Because that is the only correct way of getting rid of stigma, is to talk about it. Talk as much openly as you can. As I've said that it's around 1% prevalence, that means 1 out of every 100 might be suffering from vitiligo. So you need to talk a lot about it, spread correct information so that a person, if they spot one lesion, they can go and consult a dermatologist and we can start the treatment early, we can counsel them early, we can tell them what to expect. So spreading correct knowledge is very important. And I always say to my patient that if they have any doubts regarding vitiligo, they can come anytime and clear those doubts with me. And having vitiligo is definitely not the end of the world. If you're taking treatment for vitiligo, let it go on a parallel track, enjoy your life on another track, keep on doing whatever you were doing before that. There is no restriction, daily activities, live your life to the fullest. So 25th June is the World Vitiligo Day. We just had a few months back, and it is completely okay to have vitiligo. Just search for a good dermatologist and get on a treatment together. If you have any other doubts, so my email ID would be displayed, and you can write to me anytime you want, and I reply to all the queries regarding vitiligo. So with that, I'll finish my talk.
I think you can stop sharing your screen, Saurabh, so we can have a view.
Yes, ma'am. Just a second. Done, ma'am.
That was an excellent talk. I don't know where to get started. You have covered everything so well, right from giving examples of famous people and then assuring us that this is treatable. Also, this is, I did not know that medical science has actually advanced to that stage that we are able to, treat this so effectively. And of course, what was very touching was the way you have described how the patients feel about this, the myths and the misconceptions. And what was most useful was the way you have advised how the people around those patients should give a psychological and every other kind of support to the person. This is so important. And this is something, so many myths of ours are clear today, Dr. Saurabh. And I wish to thank you so much for this most useful talk. And I'm glad you have shared your email so people can get in touch with you if they have any more questions. And I wish to thank you from the side of Biofootprints. It's been wonderful, and we hope to have you soon again. Thank you so much, Dr. Saurabh.
Thank you, ma'am.